Hey, everybody, welcome back to another exciting episode of Telemedicine Talks. This is your host, Phoebe Gutierrez, and co host, Leo Damasco. It's just us this time around talking about us. Take a deeper dive into what you've helped other businesses do, right? You've mentioned it before, and it begs to be repeated. You've helped a bunch of startups start up. And also, with me personally as well, you've helped connect a bunch of physicians with nurse practitioners, with PAs, and startup collaborations and whatnot. You've also helped build PC MSO structures, so forth and so on. And it'd be helpful to know, how the hell did you actually do that? I take it for granted when I walk into these kind of relationships. I'm like, oh, okay, it's set up, but there's actually some work behind it, obviously, right? But so, yeah, walk us through kind of how you've done this and what we need to pay attention to. What are the steps? Like, how do you do it?
Yeah, I think it's an interesting topic. I kind of also have glazed over it over the years of just working on all of these different practices and getting to kind of learn from each client that I get to support. But it's been interesting, the start of this year, I've had so many different people reach out and they're all kind of asking the same questions. And the big question, of course, is always, can I do this in my state? So if it's a physician, for example, who wants to do a telemedicine company, or if it's a PA who's looking to start something in Texas, the rule of thumb that I tell everybody, even before looking at anything, is there's a way for anyone to own a medical practice in the United States. And the easiest thing to look at is look at a Hims and Hers, look at any telemedicine platform out there. Most of them are not owned by physicians, and they're still somehow functioning and providing clinical care. So in all 50 states, there is a way. It's the PC MSO structure, in which we've all talked about. Now, if you don't have to have that structure, or there's different options because you're a clinician or a doctor or whatever, you want to explore that because it's cheaper and it could save you some hassle. But the first thing that I always tell people is figure out what structure you have to have in your state and make sure that you're not just saying it's a PCMSO, because in a lot of states, it's not. It could be a professional association, it could be a
Mhm.
PLLC. I'm not going to bore everybody with it, but there's so many different things. And the big thing for that is, again, it's like they just want to make sure that a clinician is having the independent decision making in that state. So that's one
Now,
big
where
thing.
do you find this information, right? Is there a good, resource, or do you have to go look up each individual state, especially if you want to start like a 50 state practice?
Yeah, I mean, I think that most people are gonna go to an attorney, and, that's the expensive way, because an attorney is gonna say exactly what I'm saying, which, yes, you can do it this way, and we'll file it for you. We're gonna charge you, this much money to do each one. And the biggest thing is, like, Google it. Most of the time, like, the regulations are baked into different types of regulation packages. Most of them are in your business registration regulations, which specify who can and cannot own a business entity based on however it's categorized in that state. And then if there's any preclusion of, like, you know, only a physician, or if maybe it opens it a little bit more broadly in the regulation and says, like, only a clinician can own, but usually it's baked into those. And then it tells you it has to be 100% owned
Yeah.
by a physician, has to be 5149. And that's big for, like, the NP or the PA
Yeah.
side, or even like a chiropractor who's running a wound care business, right? Like, those are all some of the nuances that I think come into play when, you're talking about some of those things. And again, it's heavily different for all 50 states. And so, most people that I work with, they're not trying to build a national telemedicine company. They're trying to just start something in 3 states or 5 states. And I think this is helpful because, of course you want to do it in your home state, but, like, perhaps you want to try to pick states that align more with some of these rules that could potentially, you could own it, like Alabama, for example. Anybody can own business in Alabama.
Now, what if you're like, hey, I picked out these, handful of states, but some of the rules are contradictory, right? Like one state, only a clinician or physician could own it 100%, while, in another state, it has to be at least 51% owned. Like, what's the best way to structure that? Do you build two different companies, or do you just go by the lowest common denominator and just go with that? Because I could see how hairy that is. Like, especially if you're not the clinician in that relationship, then you give up total ownership when you don't have to. How have you seen that approach?
I think it depends. Like a state like Virginia, for example, like it's a non-corporate practice of medicine state, has loose rules around clinical oversight if you meet certain criteria. So in theory, like you could practice independently and operate under so-and-so structure. If you want to expand, I wouldn't say align everything across the board
Mhm.
because that's going to be costly. Now, again, I'm not an attorney. And so attorneys are going to have different, saying. I actually met with an attorney this week who told me, he's like, look, like the safest bet is to model everything after how California does it. That was like his quote, which everyone knows California is the strictest. I always base things off of risk and timing and money. And so, yeah, if you want to have the safest bet, you're going to want to structure everything independently. You wouldn't even want to do foreign registration. You would have separate bank accounts.
Oh gosh, yeah,
You
that's
would you would want to
expensive.
do everything separately,
Yeah,
but that's the least risk that you would assume. Now, on the flip side, again, cost. There's a lot of
yeah.
time. There's a lot of paperwork that will go into that. So, does it make sense for you to structure it that way? Probably not. So to me, again, those are the conversations that I typically have with clients where it's like we look at the regulations, we kind of decide what actually makes the most sense. That's again within a compliant structure.
Yeah, and getting down to the nitty-gritty, kind of nuts and bolts of it. So you've decided to create something, right? You're like, "Hey, I wanna create the structure," so forth and so on. What else do you need? I'm thinking if you're a doc and start a PC, you probably need an MSO plus minus, right? Depending on where you wanna
Yep.
go with this, right?
Yep.
You probably don't need one immediately, but it's probably an important piece of the puzzle, especially if you wanna expand, bank accounts, blankety blank. What's kind of on your checklist while you go through building an entity such as this or a practice?
Yeah. I mean, the way that I kind of categorize it is there's kind of like three main buckets that I do. You have your business plan, which is literally the one thing that so many people I think glaze over, which is how am I going to market this? Am I going to do Google ads? Am I not going to do how am I going to get patients? I think a lot of people just have this inherent audience around us, or we think we have a really great idea and people are going to flock to it. And that is not the case, especially in healthcare. The hardest thing is patient acquisition. So even before people start thinking about logistically, can I operationalize this thing? I'm actually encouraging them, like, have you sat down and done the work to build your business plan? And if you haven't, let's brainstorm and figure out what works. And that goes from as simple as how do you want your website to look? Who are you targeting? Because I'll have clients that go, well, we're targeting everyone. And I'm like, wrong. I want you to target such a specialized, super specific population that it's fail proof for you to get people because you're going to be speaking to somebody so targeted. It's an interesting thing. A lot of people think the larger the market, the more people are going to come, and it's complete opposite. So I have a client who is doing something very specific population, but she's doing it all in Spanish.
Hmm,
And to me, I'm like, what a great
yeah,
idea. Now it's just like we're going to take time. It's going to take some time to grow that. But at least, there's a niche there.
yeah.
So I say, like, that's one thing that I work with people on. And Leo, I always say, like, it's a little fluffy. People don't like to have this and all that. But that's the most important part is like you're actually doing the planning of like, what the hell are we going to put together? And like, how are we going to make money doing this, doing the thing that we actually still believe in?
Well, it's funny because a lot of these books and a lot of the people, you read the books and you listen to other talks saying, "Hey, how do you become successful? What do you focus on?" And a big part of it is, "Hey, just create your avatar," right? Just like what you're saying, create your target audience. And it goes into specifics, how old, sex, interests in, doing this exercise. You go down, you create names. They have two kids, one dog. They live in suburbia. They're higher middle class, blah, blah, blah. But you're right. You want to focus your business on a specific audience, right? Because you can't shotgun and expect to have everybody flocking to you. Another good saying is like the 80-20. You want to focus on your 80%, right? And your 80% is gonna come from a very, very small percentage, right,
Mhm.
of that population. So, yeah, creating that target audience and that avatar is key. And that goes into marketing too, the different marketing stuff, the different colors you use, font, how the approach is. It definitely changes your whole approach from the very beginning, right?
Yeah. Well, this is kind of a funny thing to say, but Leo, we always joke like you speak doctor, I speak compliance. We somehow get along because doctors care about compliance. You guys are the only ones who really do. To me, I find it funny. And that's the thing that you need to find. You need to find your person who also kind of understands what you're saying. You want to speak the same language, but that's not super clinical. And that's how you pull people in. One of the other things that I focus a lot of time on with my clients is how can we actually turn you from clinician to entrepreneur? And part of that is I don't want to hear gestalt and I don't want to hear intubate and I don't want to hear that. I want to hear layman's terms, really relatable stuff. Because to me, again, you're trying to speak to an audience that does not understand this stuff. And so one of the big things I work on is I review websites, I review social media plans, I review all this stuff because I'm like, over everyone's head. We want to make it to where people understand so they can find you. Otherwise, if you keep talking in clinical words, you're just going to find more clinicians.
It's funny. It reminds me of kind of, like social situations, right? Where, our friends get together and unfortunately being doctors, you get stuck into, training world where nobody wants to be your friends. And the only friends that you have are the ones that are around you, really just the other doctors, right? Because I find friends somewhere and they'll, but we get together and if there's a non-doctor in that social situation, we're joking around and all the references, all the jokes go straight over that non-doctor's head, right? But, you're right. Other doctors are not gonna be the clientele that you're trying to get. And I think we take it for granted, right? Because for most of us, we just get hired into a clinical situation. Somebody else is in charge of marketing. This bigger company, either if we work for a hospital system or, even if private practice, you've hired somebody else to do that and you just focus on that. But, especially starting up and being bare bones, you don't think about those things until you have to. And then we just don't understand. And I think another thing, and when we were coaching other doctors to transition to telemedicine, one of the things that stood out was you've kind of mentioned it, but the transition from being a physician to an entrepreneur, not just the language, but also the mindset. It's that mindset approach. And this comes up often, I think, in a lot of discussions, especially with other platforms and just helping build other platforms as a doctor side, changing your risk profile and changing how you approach problems. As physicians, as clinicians, we are set to have the lowest risk profile that we can.
We want you to have a low risk profile too,
Yes,
right?
in the clinical side, we don't want to kill anybody, right?
That's this double-edged sword, right?
Yeah.
Where like I wouldn't tell a doctor to be like, take that risk during that knee surgery. Like you do that thing that you think feels good in your gut, right? But on the business
Yeah.
side, it's that experimental side that physicians are not taught to be comfortable
Yeah.
with.
And we're not. And this actually came up. I went to health and went to a couple of talks, and this came up specifically. The business guys were talking about dealing with doctors, and doctors could not get over the whole approach. Oh, we're just going to do it. And if it fails, it fails. No, doctors are very used to making proactive plans where the risk of failure once it's implemented is as near as zero as we could get. And really the time frame and how quick things churn, especially in the business entrepreneurial side, you just can't do that or you're just going to get bypassed. Nothing will move. And I think there's a lot of friction when it comes down to, if you have a clinician, physician leader versus a business leader and how to approach things, you're going to get that friction because one side, usually the business side, is just go, 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 while the clinician side is like, hey, let's formulate this plan. Let's try to think, what are A, B, C, and let's see what's going on. But that takes a while, right?
Yeah. Well, and I think that's one of the things why I like working with clinicians. It's actually been really interesting because so I get 90, not 100% of my business from people that come to the, how do I do the MSO? How do I
Yeah.
do what is this rule? How do I set up the business? And then it's like after the first conversation or two conversations like that, I mean, that's the easy part. The hard part is all these other things that you haven't thought about, which is how am I going to stay motivated?
Yeah.
How am I going to work with a web developer when I've never worked with a web developer before. I mean, I just had a client who's somebody you're working with who, had never thought about the marketing and the web development side of it and was like, I don't even know what to do. And again, it's like my experience in working in these companies is like, no problem. We got to write some content. So to me, half of it is all these things that, to your point, were taken care of at other companies. And it's the angle of, is it possible the compliance side that's actually relatively easy? It's the hard part is getting your first patient, figuring out how you're going to network and getting out of that like discomfort of kind of being an imposter a little bit.
Oh, absolutely. Getting over
Really?
that is huge.
Yeah. I mean, I met with one of my doctor clients and I was trying to explain to him about let's do some meal plans. Let's throw some cool stuff in here. And his doctor's like, well, we just prescribe and what? And I'm like, we're going to get you to be real holistic. Like some of it is just reminding you guys that like you're smart and yeah, you don't just have to prescribe. There's so many other things that you can do. And you could layer this thing in and you can layer that thing in. And it's not, certain things aren't risky, even though traditionally they might have seemed so. We totally derailed this. I was going to talk about like this type of
No, but this is important, right? This is important because this is one of the major speed bumps, the inhibitors that will prevent people from actually taking off even, just getting over the mental hump of this, right? A lot of doctors will hit this and are like, I don't know how to do that. I don't know how to market. I'm scared to market myself. I'm scared to put myself out there. I'm scared to take risks. And that will actually prevent them from going forward, right? And then, we go back into kind of the clinical shell or the shell that we're so used to, the kind of golden handcuffs that we're very comfortable in, but we're just stuck in status quo, right? It prevents us from actually making that step because, a lot of us are so scared to do things that we haven't done. Honestly, we've been training for 2 decades just to make it as an attending. And really, I think part of the process too is getting there. It was very traumatic just to get there, you know? Like,
Yeah.
so do I want to learn something new? At least for me personally, learning something new in that sense, there's a lot of emotional trauma that came with it's just the residency, so forth and so on. I don't want to relive that. Do I have to relive that when I want to learn something new? I don't know. So,
Yeah, I mean, true. I've never even thought about that perspective of like how traumatizing residency and med school and like the whole thing. I can assure you it's not that painful and not hard. And, my biggest thing again is like, this is where you sometimes just need a thought partner. Sometimes you really
yeah.
just need somebody to brainstorm with and be like, am I crazy? Am I losing it here? And I think half of the battle is that, right? So it's like, I am a huge believer in private practice. I think it's the future of healthcare in America. I think that it gives people choice. I think it gives people higher quality care. And I think it would truly change the healthcare burnout epidemic that we are in. It kills me. I mean, how many doctors do I know, Leo? 100 probably at this point. And it's so sad for me to hear how sad all these doctors are, or all these nurses, or all these physician assistants. And it's like, y'all get into this field to give care, to help people, to educate. Then you get there and you're not able to care or educate or do anything because you're so scared that you're going to get sued because it's been pumped into you.
Well, the numbers are out there. Like last year during one of the ATA lectures, they put the numbers out there. 80% of the docs now are employed one way or the other. They've been driven out of private practice, and 80% of the providers are either employed by a big health system, VC backed health system, so forth and so on. But it's funny going on another tangent, how many of those systems have failed, right? How many are going back and now bankrupt and now trying to get bought out by another entity, right? So yeah, no, that's interesting kind of numbers there.
Well, I don't think people trust insurance.
Oh,
The
absolutely not. I don't think
I
so.
check, you're my pediatrician. I have another emergency medicine doctor who helps me with my hormones. It's like to me, I don't trust insurance. And a lot of the clients that I work with, they're not taking insurance. The ones that do, again, they're Medicare, Medicaid programs really trying to focus on expanding access in places where there isn't any. And so to me, it's this really interesting thing where I think that doctors could find new passions, they could be reinvigorated. And I don't think it would take that many patients to honestly build your practice up to where you're self-sustaining. The hardest part about it is it takes time, and we
Yep.
live in a society that is so impatient and has issues with like instant gratification. But for doctors who are doing locums and doing telemedicine gigs, like you could very easily build your own practice at your own pace and like do it the right way yourself, the right compliant way, provide the services you want to provide the way you want to provide it. And to me, I think that's the future of what we need in America. I do not believe that insurance has our best interest at hand. And I think the longer that we're all thrown into that, I mean, we had Wyatt on a couple months ago talking about how much cheaper it is to get a service if it's cash pay
Yeah.
versus, bill insurance. And that's what I think about. Like at the end of the day, I might as well just every month that I'm going to pay to a premium, I'm just going to throw it into my savings account, save up, and then pay cash for services. 'Cause I'm
Oh,
not
you have
even
bigger
that
balls than I do.
Yeah.
When he said that, I was like, oh, yeah, that sounds great. Gosh, it's a
Um,
big leap of faith.
I mean, will I ever leave Kaiser? No, my husband's a government worker, so I'm covered. But the last time I went to Kaiser, I mean, it's probably been 5 years. Sorry, this took a crazy turn into my opinion about the insurance industry. I will just to tie it all up. I've been inundated with people asking, and again, it's a nurse, it's a physician, it's a chiropractor, it's a nutritionist. Every single story has been, I want to provide care because I'm so passionate about X and I can't do it because of Y. I work for this clinic and they don't let me provide the diabetes care I want to. I work here and I can't do this thing and I'm so burnt out and I hate it. And so to me, there has not been a single person that I was like, you can't. I've been able
Yeah.
to like tell them exactly like how to get that process started. And I'm heavily convinced that more and more people are leaning into it. And so I really here just wanted to explain like it is possible. So if you've heard that it's not, it is. Is it complicated and does it take time and is it a little tough? Just like everything else in this world, right? But for the clients that I had, we're going to have them on in a couple weeks, but a group of PAs that all launched separate private practices and they all, have been leading up to this launch and, finally launched or getting their first patients. They are so happy and glowing. It's great. And so to me, it's like showing those success stories and being able to share this stuff more and more, I think is just really important because it's all possible. You just got to figure out how to do it, come up with a plan, make sure you're doing it the compliant way because no one's going to jail, and stay motivated and have some encouragement and the right support in your corner.
Yeah, no, this is a good words of wisdom too. And I'm gonna exclamation point the compliance part too. We've had a couple of guests here that all in agreement, right? One of the pieces of the puzzle is even early on is compliance, right? In addition to your market plan, in addition to the right finances, how to move the finances, the ownership structure with a PC MSO. And that's another puzzle, right? You were talking about just depending on what state.
I cracked it, but yes, it's
It's tough though. It's funny because a lot of people don't realize, you know, with this PCMSO structure that there's a way the money has to flow, and the structure that is confusing to a lot of people.
and that's what regulators look at.
Oh yeah.
Well, let us see your bank accounts. And, that's the first thing people look at. So, yeah, I think again, it's really easy to set things up incorrectly. So, do it the right way because it's not more work. It's a lot more work to
Yeah.
unwind.
Yeah.
But yeah, there's a lot of other pieces. I know we glazed over it. I think what I'm trying to say too is there are a lot of pieces. So get ready for a little bit of a roller coaster ride, but it is not something that's in perpetuity. I think most of my clients have been able to set up in about 2 to 3 months.
Oh
Uh,
yeah. Actually, you answered the question even before I asked it. Yeah, it does take some time, but it doesn't necessarily take that long. How much does it cost around
Um,
conservatively, right? Depending on what lawyer you get, so forth and so on. And a lot of times you've been able to actually save people money, right? Bypassing the legal costs because you know how to set up the PC MSO structure. Of course, you need legal, right? You need to have somebody on retainer in your corner. But when I was looking into it, setting up PC MSO, legal actually was like, hey, we could do it. It's very expensive. Here's some people that can. So they actually farm it out. But how much would that cost in terms of just planning ahead?
yeah, I mean, so you would want to think about what your business entity fees are.
Mhm.
So in some states, like, I mean, I could say California, you're paying about, I don't know, to set everything up, probably like $500 plus the cost of your annual taxes. California has like an $800 fee. Let's say you do Delaware. Lots of people do Delaware for tax purposes. Delaware is like $300. So you're looking at like $300 to get the business set up, right? There's a couple fees that you're going to need to have day one. Malpractice, of course, as a
Yeah.
physician, you're going to need malpractice, right? From a business side, like I'm going to tell y'all to get, professional liability, you're going to want cyber insurance. So malpractice, let's say is 3 grand a year, you know, those other ones that I just mentioned is probably another thousand. So $4,000 a year for full protection, right? Let's get you protected end to end. We're going to want to add some other softwares to make sure, that you can scale. So website, domain, email, registered agent, EHR. So, you're looking at like a tech stack of, let's say, $300 a month,
Yeah.
right? And that's mainly going to be for your EHR because I would encourage you to get a higher end EHR that kind of consolidates a lot of your tech stack. So you don't need a CRM, which is like how you
Mhm.
track people and market. We'll want to bake all of them in. Again, I encourage everybody to hire a VA. Usually you can get a really solid part-time support for under $1,000, and that 1,000 is probably on the higher end.
I'm going to exclamation point this one too, because dude, a VA is worth its weight in gold, right? You think about how much you pay the VA versus how much you make per hour and how much they save you. If I have my VA work 5 hours a week, I've paid off the VA fees. And yeah, a lot of
I
doctors are like trying to skimp the VA part. I'm like, get a dang VA and let them do those things.
Yeah, no, I completely agree. I think it's really important for people to delegate out the
Yeah.
things that are not their strong suit. I have had clients that are like, I can file my own business entity stuff, I can do this, but I really struggle on, the marketing side. And it's like, well, let's get you a social media manager VA who can give you topics and can force you to give videos and yada, right? Let's try to make this as painless for you as possible. You can use a VA in any way that you want for the most part. And I've heard, a lot of physicians are like, how should I? It's like, you tell me. Like, what? So I always say, delegate the things that you can't support, get the support that you need, right? So
Mhm.
you're going to also have just like service fees. So as you think about it, you're going to need an accountant.
Yeah.
And then depending on like legal fees. So some people actually join other kind of like legal networks, which is what
Mhm.
I recommend because it's so much cheaper. You can get on something called Up Counsel and have different documents reviewed. If you're going the legal route to have like the contracts and all of that set up, you're probably looking at around $10,000 for that entire process, which I know that attorneys that are listening are going to hate this, but like it's all template. The hard part is figuring out what the attorney won't tell you, which is what is fair market value. And that's where we got to get creative. And it is an interesting thing, but I digress. So those are kind of the key things that you need to think about in terms of like a budget, right?
Yeah.
So really depending, the things that are the most important are you need the business set up, you need your malpractice, and you need your tech stack to
Yeah.
kind of get started. Whether or not you want to do the expanded insurance when you start is up to you. Whether or not you want to have, support or, have legal assistance or get a consultant or whatever, all of those other things are kind of optional. So I say you could definitely do it for under $1,000.
Yeah. That's not a bad piece of change, right? Especially if it's going against your expenses.
Yeah. And I always say too, one interesting thing that I've seen a lot of success in is I think everybody needs some sort of encouragement. So when I first started my consulting firm, it was me and my sister-in-law. Didn't work out. But she gave me the encouragement to actually do it and jump in. I have a couple clients that they're partnerships,
Mhm.
2 NPs, a PA and an NP, a physician and an NP. And to me, it's this interesting thing where they kind of hold each other accountable and force each other to keep pushing.
Yeah.
And so if this is something that you're a little scared about, I do recommend like have a conversation with one of your colleagues because I can almost guarantee they're thinking the same thing. Unless they're like fresh out of like med school or PA school, then they're probably still real happy.
With life.
They really still have life.
There's no salt on them yet.
Yeah.
No
Well, that
rust
was
yet.
funny. I saw a meme the other day and then like I reposted it and it was like, if you haven't thought about like selling feet pictures on the internet, like, do you really even work in healthcare? Like, feel that one.
That is so true. They're so bright-eyed and bushy-tailed. It's so cute
Yeah.
when they first come out.
But I think that's the sad thing too, right? I think it happens in a lot of these professional industries where you are going to school and it's fun because you're learning and you're going through those motions. It's the practice aspect, I think, that is the fun part, right?
Yeah.
And it's exciting. I think what gets hard is there gets to be a point where you are the expert, right? What do they say in med school? See one, do one, teach one.
Yeah. See one, do one, teach one.
So you get to that point where you're like, okay, like now I want to go teach people. And then you have insurance or whatever system, but no, you can't. Like we actually can't have you say those things that we've trained you to have this brain and to think this way and to assess. Like we actually don't want you to do that. Go read from the screening tool that's in this system or click this button. I think that just turns into this idea where it's not fun. It's not
Yeah.
exciting. It's you just, yeah.
Well, that's a big part of the burnout, like, right?
Yeah.
Yeah, no, most definitely.
Yeah. I mean, that's why I do startups, to be perfectly honest. I get certain things just get kind of boring. I like learning.
Yeah.
I learn something new from every single client because I don't go in going, I've done this before. I know exactly what to do. Every single one is so different because that's what makes it fun. I tell you what not to do. I tell
Yeah.
you what I've seen work and what hasn't worked. But at the end of the day, like part of the process is like everything should be not so customary. Everything should be different.
How can they get in contact with you if people are like, "Hey, I need help"?
Oh, Phoebe at Camino. So my name at Camino, CAMINOSG.com or Phoebe at telemedicinetalks.com. I joke and say if 5 minutes with me can save you hours of pain and anxiety and frustration, I will give you 10 minutes. So please don't hesitate with reaching out. I believe so much that we need this is one of the reasons why this is my niche. I really believe in making this work for the people who need to provide our care.
Thanks. I know I lean on you a lot for these things too, so
That's how
definitely.
it's supposed to be,
Yeah.
right?
Yeah.
Like to me, it's so funny. I spend a lot of my time. We talk, we brainstorm. I mean, Leo, you know how I work because you get it because we're friends. That's how I am with a lot of my doctor friends. And it is funny because you're able to just work through stuff so much
Yeah.
easier when you have somebody in your corner.
You can't do this on your own, especially nowadays, I bet you there's one or two that are like, "Oh, okay, I know it all." But there's a lot of things that we don't know that we don't know. So getting people in your corner to work things out, especially people that have done it already, is critical. Yeah, absolutely. Cool. Well, shoot, you know how to get in touch with Phoebe. Drop us a line too. If you want to be on, just drop us a line as well. info@telemedicinetalks.com. And yeah, no, thanks for listening. Phoebe, any last words of wisdom?
No, just do it the right way if you're going to do it. Otherwise, you're just going to spend a lot of time staying awake at night and unwinding things and paying a lot of money that you
Paying a
don't
lot
want.
of unnecessary money. We've seen that a lot too.
Yeah.
So, well, hey, thanks for listening, and we will see you back next week. Thanks, y'all.